All right. Well, it sure is a pleasure to be here with you to talk about Google Cloud as a foundation for digital transformation in healthcare. We're glad that you could all join us today, and we're looking forward to an engaging and informative presentation. So my name is Sunny Southern, and I am the Vice President of the Health and Life Sciences Division at Onyx. We have a very strong presence in Canada with locations and people in Toronto, Montreal, and actually throughout the country. I've been in the health and life sciences space for about 20 years, doing innovative projects with leading organizations that are transformative. And I'm joined here today with Mike Krieger, who is the Public Sector Chief Technology Officer for Google Cloud Canada. Mike, would you like to say hello?
Hi, everyone. Thank you for joining us this afternoon. My name is Mike Krieger. As Sunny mentioned, I'm the Public Sector Chief Technology Officer. Prior to joining Google, I was working for New York City, working very closely with the New York City Health and Hospitals Corporation. And I've been involved in the cloud for over 10 years and working with Google Cloud Technologies for about 4 years. It's great to be here. Thank you for your time.
So I'm sure that everyone is familiar with Google, and that's not surprising because Google has over 10 products with over 1 billion users. And in order to create 10 products with over 1 billion users each, you must be doing something pretty special. So Google has this amazing culture of innovation. And for those of us that have been in the healthcare and life sciences space for any period of time, we all recognize that there's some improvements that could be made in the way that we engage with our customers, both on the professional side with physicians and clinicians, as well as on the patient side with our end users. And so we're really excited to see Google making a really strong entrance to help us in the healthcare and life sciences space. And also would like for you to know that Google has a very strong presence in Canada. And we'll talk more about that in a bit. Before we dig into the real technical stuff, let's start with the mindset. Let's think about what it means to transform digitally. And I want to start with a story that's really near and dear to my heart. So we have the honor to work with a world-class clinician in the behavioral health space. And this clinician has developed a clinical process that has demonstrated a very significant improvement in outcomes with patients that are living with a behavioral health condition. And over the last 25 years, he has perfected and proven that this clinical process with a survey or an instrument has improved the lives of patients living with this behavioral health condition. But unfortunately, because the process is so manual and it's a lot about filling out paper forms and faxing them back and forth over a 5-week process, and because there's so much manual process and art, there's only 3 people in the whole world that know how to administer this particular process. So they can only see 1,300 patients a year in this particular center. And he reached out to Onyx and asked, is there a way that we could help him to transform this clinical process into something that would allow him to provide more care to more patients? And so we have the honor of working with him to digitize, automate, virtualize, and scale his clinical process and instrument to be able to move from 1,300 patients that he can see a year to 28,000 patients, and in the near future to be able to support patients living with ADHD throughout the world. So I would bet that many of you have similar experiences and challenges where you've got this really wonderful service that you can provide to patients or to clinicians that you would love to be able to get to more people, but you don't have the right infrastructure, or you don't have the right tools, or you would just like to find better tools to help you do more faster and securely. If you have some of those ideas that you'd like to share with us, go ahead and pop them in the chat and think about them so that we can talk about them at the end during the Q&A. All right, so now we've started out with a real world problem that the Google Cloud Platform with Onyx services can help to support as a great example for digital transformation. So what else are we going to talk about today? So first, we're going to do an intro to Onyx and Google Cloud, because you need to know a little bit more about who we are and Google Cloud as a support for an enterprise, not necessarily just the consumer side of Google that you've seen before. Mike's going to do a pretty detailed review of the security and compliance of Google Cloud. Then I get the fun opportunity to tell you about why Google Cloud and healthcare and life sciences. And then, of course, we've got time for Q&A. So first, I get to talk about Onyx. So who is Onyx and what does it have to do with Google Cloud? So Onyx has been a Google Cloud Premier Partner, so we help take the amazing technology that Google builds and deploys and help organizations successfully adopt those technologies. We've been serving healthcare and life sciences organizations since 1993. We were the first Google Enterprise Partner in 2002. Our engineers have over 120 technical certifications, and we're 11-time Google Partner of the Year. And we do support the full Google stack for the enterprise. So whether it's deploying Google Maps platform to help with location finding for physician practices or even Starbucks, deploying Google Chrome from a Chrome browser support or devices, leveraging G Suite, Google Cloud Storage or the Google Cloud Platform, our engineers can help you across your cloud journey. And why Onyx for health and life sciences? Because we bring the deep technical cloud expertise of strategic consulting, application modernization, data engineering and insights in cloud security and governance, and combine that with what's important to people that are like us in the health and life sciences perspective field, speaking our language, knowing the different data formats, and being able to help us along our own journeys and accelerate them. We have specialized experience with Google-specific products in the healthcare and life sciences space, including interoperability, population health collaboration, and genomics. And now I'm going to hand it over to Mike to tell you more about Google in the enterprise space, and then he's going to talk to you also about security. Mike?
Thanks, Sunny. So you may know Google from this. You may see this on a daily basis. You may be using this multiple times throughout the day. Really, when I think of Google, it's really what's on the next slide, please. Nope. It's really all the infrastructure and the systems that Google's actually built to power that, to organize and gather the world's information in a way that makes it accessible to everyone. And a little bit about Google's structure. Next slide, please. Google Cloud is a part of Google, but we're an enterprise offering. When we're targeted to enterprises, it's very different from our consumer side, which is targeted to everybody, and that's our services from search and ads or our free Gmail. Google Cloud is really targeted to enterprises where your data is really your own and your services and your applications belong to you. And I'll get into that in a little bit. Next slide, please. And where does Google fit into Alphabet? You might have heard of Alphabet. Alphabet is actually our parent firm, which is an umbrella for a number of what we call bets, including Waymo, self-driving vehicles. But for healthcare, what may be interesting is our Verily group, which is working to improve the quality of life. Our Calico, which is doing longevity research. Our DeepMind group, which also has DeepMind Health and has been working on AI and ML, most recently around COVID. They had actually found new protein pathways that could be potential candidates to develop treatments for COVID. And Google Cloud sits within the Google organization, and alongside YouTube and Nest and Android and Maps and these other services. But we're a distinct organization, really catering and targeting the enterprise user. Next slide, please. Oh, and there we are. And what is Google Cloud's mission? It's really to use the power of Google to become a force multiplier and accelerate your digital transformation in healthcare. And we can do that by enabling secure data interoperability, helping you launch and scale digital applications, helping you surface insights from analytics on your healthcare data, helping you to train artificial intelligence and machine learning models, not only train and integrate them, but also explain why they're giving the answers that they're giving. And then provide collaboration. We're using Meets today. Meets is used in a number of hospitals throughout the world for telehealth, and especially since the impact of COVID, the need for social distancing has tremendously enhanced the need for televisits, telemedicine. Next slide, please. And a little bit about Google Cloud in Canada. So we talked about internationally, but Google's got a significant presence in Canada. We built our first data center in the Montreal region in 2018. We have staff present in Kitchener, Waterloo, Montreal, Toronto, Ottawa. We have 4 artificial intelligence labs from both Google Brain and DeepMind in Toronto, Montreal, and Edmonton. We're making significant investments. We're opening a new region in Toronto in the middle of next year to further enhance our offerings in the Canadian market. And some of those investments in Canada have also led to what's on the next slide, is actually helping Canadian businesses to save money and provide productivity gains. So we've seen that through Google Search and through our Meet technology and G Suite, we've saved Canadian businesses over $860 million estimated in productivity gains. And we've also saved them 300 million hours a year. This is from a study published by the First Public Institute in their first public report on Google's economic impact in Canada. And so we're looking to bring some of these effects to the healthcare industry and to your organizations. Next slide. So maybe let's talk a little bit about privacy, security, and compliance. And I wanted to cover kind of 4 main topics. First, ownership. And I want to be very clear about this with Google Cloud. When you bring your data to Google Cloud, you own your data. It belongs to you. You control that data. You control access to that data. And that control includes not only who can see that data and when they can access it, but where that data is stored, whether it's in the Montreal region, or perhaps, if you're open to it, you can choose to store it in the European Union or in the United States. But you have complete control over your data when you bring it to the cloud. We work with you to protect your data, both against external attackers, but also against insiders. We provide things such as access transparency logs, so that if you work with Google and there's a tech support issue and you require somebody from Google to access a part of your cloud to do some troubleshooting, you have the ability to provide that consent. A request will come to you. You can see the reason for that access. You can provide that consent, and you have a full log of every time your account was accessed by anybody at Google. And our privacy practices and security practices are audited against various international standards, including ISO 27001. We have SOC 1, SOC 2, SOC 3 reports. We publish the CSA STAR Cloud Security Report. We've also worked on PHIPAA and PIPEDA compliance, and we're working with the federal government on additional federal government compliance regimes to really bring the best of security and all the available controls to you. Next slide. And that best-in-class security, really extends from the devices that we produce all the way to the data centers that we operate. Data protection, as we talked about, we support compliance with PHIPAA. Our Google Cloud Healthcare API has built-in de-identification technology, which can remove or mask personally identifiable information, which will allow you to kind of securely share and collaborate should you want to share that data, whether internally or externally. Data stored in Google Cloud is secure by default. It's encrypted. The data is encrypted at rest. By default, you don't have to toggle that on. And we give you options whether you want to leverage the key solutions that we provide natively in the cloud, or you can bring your own encryption keys. And our data centers and our networks have been designed with security from the ground up, and we'll talk about that in a little bit. Google has been named a leader in public cloud native security by Forrester in 2018. Next slide, please. And so for us, security is really built in. It's not bolted on. It's really from all of the layers of the infrastructure, starting with the hardware, where Google actually builds its own servers and hardware, its own chipsets. It creates its own firmware. It builds its own operating system. So we built our own software-defined networking. We've built our own storage. So we really own that supply chain. We don't buy, off-the-shelf hardware. Our engineers and our security engineers are intimately involved in the design and operation of all of these components, all the way up to the network and to our applications. We run a bug bounty program It's quite public. We also do research on vulnerabilities, not only in our software, but in publicly available platforms and other solutions to help the entire internet and all kind of IT users benefit from having more secure systems. So security is really at the core of what we do at Google Cloud. And compliance for protected health information, as we kind of touched on, you control who has access to what data and where. So that's data locality, down to which data center within Montreal you want your data stored in. Encryption at rest and in transit, control over the keys that you use, whether you bring your own keys or rely on our keys. Fine-grained user access controls, so down to row or column level in our enterprise data warehouse solutions, for example, where you can control who's accessing that data within your organization or externally. Well, also in our cloud storage, our cloud storage natively is not exposed to the internet. It's actually a multi-step process to expose a bucket to the internet. And we also provide that logging, as I mentioned, so full logging of all access by your own staff or by members of Google is available. And we also provide kind of strong deployment templates, so you can standardize as you're deploying workloads on our cloud. You can have a standardized deployment. Next slide, please. And as mentioned, our compliance offerings, the ISO 27001, SOC 1, SOC 2, PCI DSS, just a number of international standards we built on the FedRAMP, moderate and high in the United States, and then PIPEDA and PHIPAA in Canada. And we're continually adding new certifications and new compliance regimes to this list as we're growing our cloud and as we're expanding into new countries and as new compliance regulations are being published. Next slide. Sunny, back to you.
Thank you so much, Mike. I think you did a fantastic job of describing the strong foundation that Google Cloud provides to protect the privacy and security and compliance of the data. And that's just absolutely fundamental for getting started. And now we get to talk about all the amazing things that we can do once you're able to use the cloud. And Mike, I'm going to call on you, as you know, a couple times throughout this rest of this presentation as the CTO for Google Cloud Public Sector in Canada. All right, so first of all, we'd like to talk about a journey, right? So getting to the cloud isn't as simple as, let's go migrate a VM to the cloud and start using it. It can be that simple, but really we like to help our customers think about using the cloud in a very strategic and comprehensive way. And whether you're just in the early stages of your cloud journey, starting to think about moving that data to the cloud and getting ready to start using it and configuring your cloud environment, modernizing a few components for your workforce, or you're in a position where you're optimizing, really creating additional security controls that you can put PHI or HIPAA data in the cloud, building applications, and then enabling virtual care and remote work, or you're at the stage of really trying to accelerate your applications and use of your data using AI and ML, we can help you wherever you are along that journey. Just like we've helped many customers along their journeys. So a couple of customers we're going to talk about today. First of all, we're going to start with Meditech. Many of you are probably very familiar with Meditech. It is one of the most widely used electronic health records in Canada, as well as across the United States. And they've been a very long-standing Onyx and Google Cloud customer. We started helping Meditech deploy G Suite 8 or 10 years ago. And then as they have progressed along their cloud journey, we also help them now with securing their cloud environments, moving and building applications in the cloud. And then, of course, all of the things that go along with that, securing the data, et cetera. We also support the Broad Institute. For those of you that are in research and specifically in genomics, the Broad Institute is one of the most widely recognized genomics organizations in the world. And for every new researcher who gets access to the Broad's Terra.bio platform, Onyx helps them to get that access. And then last but not least, I want to talk about Stanford for just a minute. So another service that we offer is that for IT departments, central IT departments like Stanford, they are world-class, but there's just not enough of them to support the researchers and professors that need help with their cloud journey. And so when researchers contact, or professors or anyone at Stanford contacts Central IT, oftentimes the Stanford IT department will reach out to Onyx, and then we help those employees and staff members get access to their Google Cloud. If you have any more questions about any of the other organizations on this list, feel free to put it in the chat and we'll do our best to answer it, either via the chat or during the Q&A. All right, next let's talk about how Google Cloud supports healthcare and life sciences. So we're just going to do kind of a high-level overview, but to start with, we've got to make sure that the standard data formats that we use in healthcare are also supported in Google Cloud. So from EHR data to imaging data, genomics, telemetry, and then using the ML tools, the Google Cloud was designed to support these specific data types. And then Mike did a fantastic job talking about compliance, but we just can't, we know how important it is, so we keep peppering it in here so that everybody feels comfortable with how Google Cloud meets the requirements needed in order to protect, secure, and make your data compliant. And then on top of this great infrastructure are Google Cloud's applications and also your ability to build applications on top of them. So everything from Google Cloud on the left to Android on the right, and that full spectrum. All right, so we want to dig in a little bit deeper into a new service that Google has made available called the Google Cloud Healthcare API. So this is an API that's built right into the Google Cloud platform. It's not a separate service or application that you have to purchase and try to figure out how to configure. It's very simple. You just toggle switch and you're able to start using it. And the Google Cloud Healthcare API can do everything from helping you to store and manage your FHIR data to ingest and create HL7v2 messages, store and manage your DICOM data. And there are many organizations that are trying to either move the EHR data to the cloud or wanting to get out of the data center business. And a big place to eliminate servers is with images, because we know that takes up a lot of space. And then once again, you get the data to the cloud, there are many tools that help you do what you need to do, like de-identifying your data so that you can allow researchers who are not necessarily on the need to know from a clinical perspective to have access to your data, but need access to the data so that they can build models to help power things like precision medicine and even improved operations. And then all of this gives you the power to unlock the potential of large-scale analytics to provide insight into population health. And where we are today with the pandemic, being able to do that at scale, collaborate effectively and compliantly is critically important. So this is all protected by best-in-class data privacy, security, and compliance. So let's talk about the platform layers for those of you that are more into the technology side of things. And Mike, please feel free to jump in here as the CTO if you'd like. But the platform layers really start with the healthcare API, with the data formats. And then we move into being able to leverage the cloud services around the APIs and machine learning, auto ML tools and things like that. And then all the way to helping you to build your applications at scale in a robust and secure environment. Mike, is there anything you'd like to add there?
Yeah, I think I don't want to get ahead of us in terms of the slides, but all of this is kind of underpinned by Google's enterprise data warehouse technology called BigQuery, which is a serverless, scalable engine that basically you can throw data at. It speaks SQL, and it can ingest data using the Cloud Healthcare API. You can bring that EMR, EHR data using FHIR into BigQuery to then do analytics, to build machine learning models, to leverage our visualization tools. Yeah, here's the slide. Yeah, exactly. You can bring all of that, the packs and the metadata around your images, your genomics data, your variant sequences with our variant transforms tools. You can bring all of that into BigQuery, and then you can do very sophisticated visualizations and dashboarding and analytics introspection on it. So this is a solution that really kind of underpins and powers. It's built on the technology that allows Google to kind of index all of the pages of the internet, and now it's available to you and for healthcare in particular. And it also can understand, healthcare semantics. It has, has understanding of healthcare terminology. So there's additional healthcare functionality being added all the time to BigQuery.
Thank you, Mike. And as a reminder, Tia just posted in the chat function, but if you've got questions, I saw a few eyebrows raised over there, so feel free to chat your questions in the chat function. So Mike talked about security underpinning everything, and then what we'd really like to end on almost, we've got one more concept we want to talk about, but the fact that AI and ML are embedded to all the tools that we utilize within the Google Cloud Platform. So the insights and intelligence that are powering these billion user products, we can apply to our own applications within our Google Cloud Platform. So whether it's Smart Compose with G Suite, right, or it's in Google Drive where it recommends what the most relevant content is to you, or it's utilizing AutoML tools built into to the Google Cloud Platform, which allows us to unlock insights like never before seamlessly, accelerate analysis of our data so that we can get better, faster insight into how to take better care of our patients and run our business more effectively. And even analyzing genomes for the next gen therapeutics or better understanding of population so we can provide more personalized medicine. These tools are at our fingertips like they have never been before. And that's critically important when we come to our last content slide. And that is really bringing us all to what matters the most. So we started telling a story. They started off our presentation telling a story about a clinician who had a specific need, and we're going to end thinking about what this means for clinicians and patients who are on the front lines of caring for people. Who would have ever thought in 2020 that we would need to be able to scale our ability to provide telehealth visits from, in some places, 300 a month to 3,000 or even 30,000 a month? Given the pandemic, when we absolutely have to be able to continue to provide care and oversight of patients, but we can't see them always in person. And so having access to a platform that allows you to seamlessly scale with the tools that you already have if you're already using G Suite is really, I think, what the Google Cloud Platform was designed. So just to kind of walk you through the process, whether your EHR is Epic, Cerner, Meditech, or Allscripts, you've got data that's coming out of that in a standardized format. There are tools that are available now through Meet that allow you to integrate Google Meet in with your EHRs and other health IT solutions, and then provide you with some front-end solutions with virtual waiting rooms and a Google Meet experience that is exactly like what we're using either in our consumer life, or what we found recently is it's been amazing to see our customers who are also parents and they're having to homeschool their kids and using all of the Google tools to be able to do that with G Suite, and the types of questions and innovation that are coming from them about, well, my kids are doing this in class, can we do this with our patients? It's really been an amazing time to be in healthcare on the positive side of things. So again, at the end of the day, all of this comes to the fact that we need to provide better experiences for our clinicians and easier access for our patients. And who better to help us along that journey than the company that's created $10 billion user products that are all serving consumers with the protection, privacy, and compliance that the Google Cloud Platform offers. So no matter where an organization is in the cloud journey, it is an honor and a pleasure to help you to get to where you want to be. Whether you're at the early stage, just starting to transform the way you work, you're ready to start optimizing, or you're at that acceleration phase. We've got amazing tools that Google creates with incredible engineering resources within Onyx, and we can help you anywhere. So let's talk about what some of those projects may be. If you don't feel comfortable speaking them out loud, put them in the chat. Otherwise, we're going to open it up for questions. All right, we've got crickets. So Mike, I'm gonna get the, or you want to ask the first one? You want me to?
Yeah, I was going to ask you. I mean, how do you usually get customers started with Google as a partner of Google?
Well, that is a great question, Mike. Thank you for asking it. So first of all, for those of you that are here today, you've already started your journey, right? So you're starting to learn, and this may be a refresher for some of you. So please feel free to give us feedback. Tell us what you'd like to see more of. But the bottom line is just being here today is a great way to get started. And then we like to kind of separate the getting started path between if you're someone working in an organization and you want to bring Google Cloud to your organization, or you're an individual. So I'm going to start with an individual. Let's say you're an individual and you just want to start tinkering around. Google provides tons of education and training to make that happen. A great place to start is something called Quick Labs. Matt or Tia, would you mind popping over a link to Quick Labs into the chat? So Google provides Quick Labs and then $300 worth of Google Cloud credits so that you can just start your journey. And there's actually a beautiful interface that can show you that your first class, second class, third class, fourth class, all along the pathway to help you better understand from a personal journey perspective. And we also offer those services at scale within the enterprise. If you're an enterprise, we'd love to be, or an organization, we'd love to have a conversation with you. So we like to go in and really start to do a discovery to better understand where you are in your journey. Are you at the transform, optimize, or acceleration phase? And our engineers will then help you chart that path to where you want to be, whether it's research, clinical, it's more in the application health IT space, or it's leveraging genomics. So really across that whole pathway. Mike, do you have anything to add to that?
Yeah, and just about those various phases of your journey, do you have to be in one of those phases? Or, what I've often seen is companies may have some teams or projects that are kind of in the advanced phase, and other parts of the organization may be, in just starting out. How do you handle that?
Oh, that's a great question too. So we actually kind of specialize in that. So it's actually really great when you've got a few people that have already that are in that acceleration phase of their journey, because we can help learn from them and let the rest of the organization learn from them as we help them go back and gain the internal agreement that they need in order to get more of the organization to adopt cloud. So it makes those people that are doing the accelerated types of projects, it makes their jobs easier when we go back and work with central IT to help configure the cloud environment to be more robust and support more of their users.
Okay.
So looks like we've got one here. Let me read this one out real quickly here. So how do you implement the new systems when government ministries mandate the use of limited IT solutions? That's a great one for you, Mike.
Yeah, no, that's a great question. Thank you for asking. And I think that's kind of a two-pronged approach. One is, we're actually working with the various ministries of health to bring these offerings and these types of presentations to those ministries, and to help accelerate their cloud journey so that they can provide back those applications that are more advanced to yourselves. But I would say, building building kind of demand for more modern systems and more effective solutions, can also come from the grassroots towards the ministry, and we can be your partners in that. And there are many ways we can actually extend limited IT solutions using our Apigee API tools and our other technologies to actually wrap legacy applications with modern interfaces, with modern experiences. So if there's a requirement to use a legacy system, we can at least have your clinicians and your nurses and your doctors have a much better experience and not have to be exposed to perhaps something that is not as user friendly.
And I might add to that answer as well, is that we are together. Our two teams work really hard to find those RFIs or RFPs that the government puts out, so that we can respond to them and then be part of the decision-making process. We're also very happy if there's an individual that has a need and running into some friction about getting a particular solution approved. We're happy to work with you in order to help provide the evidence and support that may be needed so that the compliance and the regulatory or legal teams within your organization understand that how our solutions actually meet those needs. I'm actually going to go ahead and pop up our contact information so that for those of you that may want to reach out to us, you can do that. But we've got some more time for questions. So what other questions do we have? Okay, so no worries. It doesn't matter if it was already covered. So thank you for saying that, but we're happy to repeat things. That's no problem at all. Google certifications for professional development. Yes, there are definitely Google certifications for professional development. Mike, would you like to take that one?
Yeah, absolutely. We offer several certifications, including our professional cloud architect certification, a cloud engineer certification, certificates around data science. And the materials are available in Coursera and a number of kind of online training providers. We're seeing a lot of demand for our training. And so that training will give you a very strong foundation, you and your team a very strong foundation. But if you have skills in other platforms, such as AWS or Azure, those skills often give you a very good foundation to begin working with Google Cloud, and those concepts will help you get started in Google without having to do a lot of retraining.
And Tia popped up the link to the certifications website in the chat, so please feel free to head over there and take a look at that. Mike, this is going to be another one for you. So it's the question is really around the difference between Alphabet's Google consumer side of the business that's driven financially by advertising and the Google Cloud platform designed for enterprises. So could you address that, please?
Yeah, great question. And kind of as mentioned, Google Cloud is separate from our ads business, and our ads business is consumer facing. And you're absolutely right. The revenue in the ad side does come from knowing consumer preferences, right, and providing kind of useful product suggestions. The Google Cloud side is a commercial offering, is not built on any ads. It's not analyzing any of the data that's uploaded. That data again is owned and controlled and managed by you. Up to the degree that if you'd like to leverage your own encryption, so that all the data that you upload to Google Cloud can only be decrypted by yourself. We also offer that, but it's an entirely separate line of business.
Does that answer the question? If you have a follow-on, please feel free to chat it, or you're welcome to ask it. I mean, we want to address these questions outright. So if you have concerns, we want to talk about them. If you have opportunities, we also want to talk about those. But this is really an environment. It's a relatively small group here. And if you don't feel comfortable talking about it here, feel free. I've got the our contact information on the screen. Send us a message. Let us have a conversation with you offline and really dive into this.
Maybe Sunny, just to add one more point on that,
Yeah,
is
sure.
The technology that we built to power the ad side of the business. The compute, the storage, the databases, the scalability, the artificial intelligence. We realize that that is very potentially very useful and very helpful to enterprise clients. So we've taken that the best of the learnings from that side of our business and created Google Cloud to be this enterprise organization and offer it to healthcare organizations such as yours. But again, it's entirely separate. I know in the media, oftentimes there's lack of precision when they say Google. Is it Google Cloud or Google writ large? And so just wanted to clarify that.
Mike, I think there's another one that would be good for people to understand because of the number of researchers that we work with and the importance of being able to protect data while still being able to effectively collaborate on it. Could you talk a little bit about the scenario of a researcher who stores their data in Google Cloud and wants to better understand who has access and how they control that access?
Yeah, great question. And so our access logging, our transparency tools allow you to have kind of full visibility. You can maintain those logs for infinite number of years if required. But it also allows you to do things such as if you want to create a cloud storage bucket and provide very limited access to particular people. We have those fine-grained controls. You're also able to create for example, buckets where the person who downloads the data actually uses their funding to download that bucket. So we have ways of kind of cost sharing or moving the cost. I know oftentimes there's very large, multi-gigabyte files that are moved around in genomics. So there's ways to create, data sharing and data marts that way. And then, in terms of, as mentioned, our BigQuery platform, column and row level, field level security and logging is available. And then all of that is kind of encrypted at rest as well.
Which to me is really, really exciting because I'll just add a little flavor here. I was having a conversation early days of the Meaningful Use Initiative in the U.S., which, as many of you probably know if you're in health IT, really helped to accelerate the adoption of electronic health records in the United States. And there was just this tremendous frustration of the fact that ONC really wanted patients to be able to control who has access, what they have access to, and for how long they have access. And so one of the reasons that I was so excited to join Onyx and to have access to the Google Cloud platform was because of that granular level of control. So whether you're, the same thing would apply to researchers, right? Is that researchers have the ability to control who has access, what kind of access, is it view, is it edit, and then for how long. So you're working with someone who's doing some statistics against data and they're done, you can kick them out of your data set. They can't see it anymore. So it's really nice to have that level of control and the ease at which that you can have that control. So we have about 1 minute left. Does anybody have any final burning questions that you would like to ask us during this session? Okay, Mike, is there any do you have any parting words for your colleagues in Canada?
Welcome any questions. Happy to take any follow-ups. Some contact information is provided here, but happy to personally engage as well. If you have any questions, feel free to reach out and be happy to kind of step through any of the technologies mentioned in a deeper way.
Thank you, Mike. And so I think I'd like to just say at the end a couple of things. One is both Google's and Onyx's commitment to Canada. So Mike is a chief technology officer. So he's a very high level, very experienced person who is dedicated to the Canadian market. We also have a country manager with Onyx. His name is Jeff Telford. Matt, would you mind popping over Jeff's name in the chat really quick? If you're not trying to field other questions, and either Mike or Jeff would always be happy to take a conversation with you. And also know that if you send an email to HLS, so that's Health and Life Sciences, abbreviated HLS @onyxnet.com, we'll be happy to shepherd your emails to whomever it is that you would like to connect with. All right, well, we really appreciate your level of engagement, the questions, and just your time today. We know there's a lot of ways that you could be spending it. So thank you for being part of this conversation today. And we certainly hope that this is the first of many. We're grateful for the opportunity to work with you and are looking forward to helping you on your cloud journey.